Hi friends, good afternoon. So welcome to our one more YouTube and Instagram live. Now we are live on Instagram and YouTube both. So let us start our question answer session as soon as possible. Otherwise, a lot of questions remains unanswered. Today I'll be dealing with cases where you have the rains have started just now, and then you have all elements because of rainy weather or weather because of uh, air and getting wet in the rain. We'll do that, but let us first start with the question answer session. Welcome, Dr. Uh, Vilin, uh, Mubasika, Dr. Sandeep, Dr. Vishaka. So, welcome all, and let us start with the session. Few questions of the last session were still unanswered. So, instead of answering that, I'll basically take the new questions first. So, and I hope you are prepared with your questions. Otherwise, by the time I start answering, the time is over. Today we'll do something about lot of questions about what to do in the rainy weather and all. I know most of us basically have understood the mater medica, what to prescribe and when to prescribe when it is rainy weather or wet weather and all. But still, when the weather is very wet and the patient says that because of that wet weather, I get aggravation, I have this, I have that. I'll tell you some of the drugs that it will help you in your practice. Shreya, welcome. Dr. Mir, Dr. Gaikwad. So whenever there is wet weather aggravation, think of few remedies which are very very important. Of those remedies, few remedies which you know by heart, day in and day out you prescribe. That is Rustox, we have Natrum Sulf, we have Calcarea Carb, we have Rhododendron, we have Antim Tart, we have lots of remedies, wet weather aggravation. In today's scenario, when there is lot of rain, so you must ask a question when there is lot of storm, windy and stormy weather, when there is windy and stormy weather. Before that, there was a case of asthma when the patient was given lot of 3 4 remedies. It did not work. It partially worked, but the patient was I would say, had a classical modality. He said, if tomorrow there is going to be a storm or a windy weather, today I'll get asthma. So before any storm or before a windy weather, the patient's asthma used to aggravate. And I had already prescribed the patient Latrum Sulf, Rhododendron, and it worked. But I prescribed a very, very rare medicine. Not rare because it is rarely prescribed, but because it is rarely prescribed in this condition. I prescribed the patient a single dose of Belisper 200 because the patient had a classical aggravation before a storm. So I know everybody remembers Natrum Sulf, we remember Rhododendron, we remember Rustox, but Belisper we have never prescribed. I had never prescribed. So whenever you have a case where it is not getting results, go home and read Belisper beyond the injury symptoms, and you'll be surprised that Belisper basically worked very well when the asthma was before a storm or before a windy weather. So welcome Dr. Rizwan, Dr. Madan, Dr. Vaishnav. One question, Abu, remedy for weakness, chest pain, headache, vertigo, weakness and while walking and after exertion. Yeah, see, basically, if you have these type of symptoms, you have to see first the primary cause. What is the primary cause? Most of us basically have symptoms where the patient suffers from interstitial lung disease or muscle weakness, or recovery is convalescence is prolonged, and then that time you have a lot of weakness. You can think about carbohydrates, you can think about antium crude soranum. In this condition, it would help, definitely help. Welcome, Dr. Amit. One condition, yeah. So aggravation during stormy weather. I have told you aggravation before stormy weather, aggravation during stormy weather. So whenever there is रिजवान उर्दू या हिंदी लैंग्वेज यूज किया करिए. ओके, आई ट्राई टू talk in both the language, English and Hindi, so that there are a lot of other doctors who are international doctors who can't understand English, and of course Indian doctors can't understand classical English also. So मैं कोशिश करूंगा कि दोनों आपके साथ में बोलूंगा. सो हमको भी देखा है, हमने देखा है, वी हैव सीन, जब अस्थमा, जब मेरे पास केस था जो स्टॉर्म के पहले और विंडी वेदर के पहले एग्रेवेट होता था. ओके, उसके अंदर मैंने बताया आपको बेलिस्पर देने के लिए. नाउ देर आर रेमेडीज वेयर द पेशेंट कम्स एंड टेल्स, बताता है कि the patient has aggravation during windy weather or stormy weather, then the remedies sometimes change. Of course, rhododendron is there, Natrum sulphate also होता है, but you must think about natrum carb, calimure, Nux mosquita, Badiaga, and Pulsatilla. Very, very important remedies when the symptoms or any other conditions of the body are aggravated during windy or stormy weather. So दोनों प्रकार के, I have told you both, before a stormy weather and during a stormy weather, because now rains have started and we have a lot of winds going, a lot of stormy weather, lightning and all, and that's why it is not always that wet weather remedy will work. Stormy weather remedy is also very important. So when you are through with this YouTube video and Instagram live, go home and read these remedies. Very, very important. Of course, aggravation storm ki time pe, during a storm aggravates, there are lots of the remedies. Okay, apart from this, I have just told you the most important indicated remedies which I have used in my practice. So welcome Dr. Sai Kumar, welcome Dr. Alexander, Dr. Paul. Next is one thing more you have to understand. It is either wet weather or wet application aggravation and amelioration. So whenever the patient says, जभी भी मेरे कपड़े, whenever my clothes become wet in rains and I cannot change my clothes and I reach home after half an hour, though the weather is okay, I get sneezing, I get coryza, I get stomach ache, I get headache, I get migraine, I have XYZ, XYZ. So you have to interpret this in some other form. Wet application amelioration. Don't wait when the patient comes and tells you, जब भी मेरे घर पे, when I in my home, when my mother keeps a clothes which are not dried up and I wear those clothes and then I get symptom. Don't wait for that symptom, you know. Wet application aggravation. Again, think of rustox, think of sulfur, think of calcarea carb, think of antimicrote, think of chamomilla. These remedies very, very important. I hope you're understanding, you know, I hope you're understanding. Opposite condition also is there, you know, wet application ameliorates. We are talking about this condition, the today's scenario where the rains have started, the storms have started. So wet application amelioration, SRM, euhobium, pulsatilla, magnesium carb, nux vomica are also there. So these are the conditions where you have to understand. Don't wait for that literal meaning of the symptom कि भाई वेट वेदर है, मेरे मदर ने मुझे क्या बोलते हैं वो पट्टी लगा दिया ठंडे पानी की और मुझे तकलीफ बढ़ेगी. डोंट वेट फॉर दैट वुड नॉट हैपन समटाइम्स इन योर. So don't waste your symptoms and understanding that these are very important. Wet applications, wet weather, stormy weather, windy weather, and of course then you have change of weather and then you can have a lot of other remedies. I hope you understood the meaning of this weather and all. There were a lot of, there were a lot of, welcome Dr. Ruhi, welcome Dr. Trust. There were a lot of, what you call, questions regarding the weather. But basically I have just grouped and told you the symptoms. So I hope you understand and try to practice in your clinic and you will definitely get some good results. Yes, so Dr. Yinurkar, Dr. Megha, welcome. Any other question regarding this weather or I'll proceed further or we'll proceed further with the other questions? Dr. Madan, if you have any questions, you can start because otherwise I'll keep on answering those questions of wet weather, stormy weather and the time would be over. Okay, and it is not always that you, because of wet weather, don't only look about the symptoms of the nose or the smell or the throat or the cough. There are a lot of other symptoms also. One more question was that if there is boring of finger, if there is boring of finger in the nose, मतलब एक बच्चे अब कोई भी आदमी को अगर नाक में उंगली डालने की हैबिट है, so people write to me that हमने सिना दिया, we gave सिना, nothing worked, we gave Chilone, we gave Centonine. It is not always because of worms. If it is because of worms, okay, but inclination to bore the finger in the nose, it is called as digging gold. You will be surprised. If it is not because of worms, Sina has not worked, do think about Nectrum mur. Do think about Zincum metallicum. Do think about Aurum triphyllum. Very, very, this patient comes in your OPD and when he starts speaking symptoms, doing like this, and like this, trying to bore. And it is not, you don't have to ask, do you do every time boring the nose? He'll say, no, now. But if you see the patient doing continuously, it is not always because of worms. It may be Natrimur, Zincum metallicum, Aurum triphyllum, Veratrum, Thuja, lot of other remedies. Sometimes the patient bores so much that it starts bleeding. It is so much so, no? This is, and then you can again think Cinna is definitely there, but you can think about lachesis, sconium, aurum triphyllum, phosphorus also. Constant desire to warranted breeds. So there are don't always be very prejudiced in like boring down with Cinna. No, it's not like that. Okay, let us go to one question. Dr. Wasim, welcome. So stomach burning के लिए और गर्मी में headache pain और गर्मी में वीकनेस के लिए एडवाइस की ट्रीटमेंट. जब भी हमारा शब्द आता है गर्मी, जब भी गर्मी का शब्द आता है, जब भी हम देखते हैं भाई गर्मी की वजह से हमको तकलीफ हो रही है, तो 4-5 रेमेडी डॉक्टर रिजवान बहुत इंपॉर्टेंट है, ध्यान रखना. और आपने कहा है गर्मी के वजह से वीकनेस, गर्मी के वजह से गरम गरम लगना, गर्मी की वजह से सर दर्द होना, तीनों मिला के हमारे ड्रग्स बनते हैं नाइट्रम म्यूरेटिकम, एंटीम क्रूड, ग्लोनाइन, जेल्सीमियम एंड एमिल नाइट्रोजम. ऑफकोर्स बेलेडोना भी है, बट मैं इसको छठवें में डालूंगा. ये 4-5 ड्रग्स बहुत इंपॉर्टेंट है जो आपको सोचना चाहिए. और अगर रिपीटेशन करना हो तो मेरा ध्यान है कि आप एलएम पोटेंसी वापरेंगे तो आप रिपीट बार बार कर सकते हैं, क्योंकि कभी कभी गर्मी की वीकनेस के लिए हमको रिपीटेशन बहुत करना पड़ता है, और हम सेंटेंशियल पोटेंसी में अगर वही पोटेंसी को रिपीट करते तो उतना रिजल्ट नहीं आता है. कैन यू प्लीज टॉक अबाउट द रेमेडी जिनसेन यू हैव यूज्ड? Yeah, so ginseng, whenever, I hope there are no other questions, so you will start with ginseng. Now, whenever we get ginseng, now ginseng, when we were taught ginseng, when we used to practice ginseng, it was basically used as a tonic. And it was used when we were taught for tonic and as a aphrodisiac, as a sexual stimulant. And we used to give ginseng murder tincture, and nothing used to work, and it is sometimes it works, sometimes it did not work. Second thing, if you want to prescribe ginseng, it is very important that you basically get the original ginseng. There are other forms of ginseng which are there, but original ginseng work will give you miraculous results. In ginseng, if of course now I don't give ginseng for aphrodisiac or any other complaints of weakness and all, because it is written in one of the Mater Medica, the name ginseng signifies the resemblance of man. Remember these wordings, Dr. Alexandra. The name ginseng signifies the resemblance of man. If you see the root of ginseng, it resembles like a man. That's why it was used as a aphrodisiac. Most important ginseng. If you see the weakness as a nucleus of ginseng in Mater Medica, when you have weakness, thinking is very difficult, impatient is there, disposition to weep and very anxious about the future. This is what I have seen in most of the cases of ginseng which I have treated constitutionally. It is said that ginseng is basically a stimulant to the secretory gland, especially salivations. Hence, in cases where the concomitant symptom is lot of salivation, you can think about ginseng, especially when the patient is suffering from spinal cord problem, sciatica, rheumatism. I have seen ginseng work very nice with salivation. Okay, and one thing in ginseng which I have seen in many of cases, the extremities are very stiff, the joints are contracted, heavy, especially the lower joint, stiffness of the back and crackling in the joints. Normally, crackling in the joints, the first drug which we think about is benzoic acid. If benzoic acid fails and still you find crackling, stiffness is there and heaviness of the lower limb, do think about ginseng, it will work very nice. So this is the just basic idea which I have ginseng, and I have used maybe sparingly, but whenever I have used, I have seen this symptom and that have given me very good results. I hope this knowledge, whatever I have, gives you some insight of ginseng and it helps in your practice, Dr. Alexandra. Yeah, Dr. Komal, welcome. So let us go further. That was all I could know about ginseng. Let us go further to some other topics. I hope डॉक्टर रिजवान आपको इसके बारे में समझ में आ गया होगा, आपके धूप के बारे में. अभी तो धूप धीरे धीरे कम हो रही है हमारे नागपुर में और इंडिया में सभी जगह बारिश हो रही है, इसलिए मैंने रेनी वेदर का लिया है. रेनी वेदर के लिए, वेट वेदर के लिए, वेट एप्लीकेशन के लिए ध्यान रखिए. रिमेंबर, वेट वेदर एंड वेट एप्लीकेशन एग्रेवेट्स में डिफरेंस है. The same difference which is there in envy and jealousy. So हमारे rubrications भी बहुत important है. Rubrics are very important. There are very hairline differences. Those differences are there. That's why they are given in different rubrics. You know? And the remedies are also different. Make sure that you are able to differentiate your rubrics. That's what you call it's the art of prescribing. Okay. Yeah, Vinita, welcome. So this is how you must differentiate rubrications. Next, as we go further, it is also said that whenever there is what you call eruptions, especially बहुत patients आएंगे, the patients will come to you that whenever there is eruptions, especially in winters, what to give. So अच्छा, you are from Pakistan. ठीक है, लगभग हमारा सेमी क्लाइमेट रहता है डॉक्टर रिजवान, जितना मेरे को आता है वो समझता है वो. वेरिकोज वेन स्पेशली इन फीमेल. एक चीज, वन थिंग यू हैव टू रिमेंबर डॉक्टर, I don't know your name actually. Varicose vein, I had a very interesting case of varicose vein. The patient was in a habit of taking lot of contraceptive pills, and that is also side effect, and that could cause thrombophlebitis and varicose vein. So if it is there, make sure that you stop that pills, or the patient has taken before and now she has stopped and she has developed varicose vein. Two remedies you must think about, very very important. Think about estrogen and think about progesterone. Go home and read the mathematics of these remedies. Don't ask me now, because these are very very important remedies. This would open up your case and sometimes cure the case also. Apart from this, it is said that in ladies, because of the standing posture, because they get up, they work day and night, cooking, taking care of the family, that also causes varicose vein, especially after menopause, because of the hormonal problem. And that's why we have the routine remedy, like Hahnemann is there, clematis is there, rhododendron is there, a lot of other remedies. But make sure that you differentiate this from your patient and then prescribe the remedies. I was just completing that eruptions in winter. There are some cases which will come to that suddenly winter starts and you get eruptions. Suddenly summer start and they get eruptions. Suddenly when the weather is hot, they get eruptions. Suddenly when the weather is wet, they get eruptions. I had a very very interesting case of eruptions, eczema, all skin problems, especially when the weather is wet. When the weather is wet, and believe me, we took the whole case, we prescribed the remedies. I failed. I think for 6 or 8 months, the patient was only partially relieved, did not get results, and again the weather came back to wet weather, and again the eruptions flared up. You know which remedy I prescribed after studying the case? Narcissus 200 I prescribed, and the patient was much better within 15 days of treatment. This is the important, this is the power of homeopathy, and this is the power of differentiating symptoms from the patient and the mater medica. The symptom differentiation. Narcissus, I don't know the full name, it is pseudo narcissism, I think. It's from plant narcissism 200 was given, and it cured the case. डॉक्टर मयंक वेलकम, डॉक्टर रजवानिया, एक ही क्लाइमेट लगभग है. सो ये बहुत जानना जरूरी है कि आपने कौन सा रेमेडी दिया, कब दिया. जैसे विंटर एग्रेवेट स्किन कंप्लेंट्स, एवरीबडी नोज द रेमेडीज आर स्टॉक्स, but I have got very good results with calcarea carb, with sepia, and surprisingly I had 3 cases where eruptions which are aggravating in winter, strontium carb cured the case. And I only told you few YouTube videos on Instagram videos back. Think of strontium carb when the patient is aggravated, the better in sun. If you remember the case of renal failure, the patient used to go and sit in the sun and used to feel much better. Strontium carb cured the case. But eruptions, aggravation in winter also, 3 cases of mine were cured with strontium carb 200. That is the beauty of homeopathy. That's the beauty of homeopathy, mathematics and therapeutics. So that's why I'm telling you the differentiating symptoms of the remedy and the patients. Which is the rubric that we can apply to a person that has high blood pressure but very erratic. In it goes from 130 to 80, less than 5 or 130, it keeps oscillating. What could be a medical decision? Very very simple, Dr. Alexandra. Very simple case. The same applies to case of diabetes, One day the patient comes, the sugar fasting is 100. Next time comes the fasting is 300. One time comes the post meal is 250 and next comes post meal is 500. Same with blood pressure. Same with, you can say, the endocrine disorder, thyroid disorder. The rubric in this you have to take is hysterical. Hysterical or panicky. Most of these type of cases, I have entered the case, the rubric hysterical. What would be the pathology? Pathology will decide, but the patient is very much sensitive, hypersensitiveness. And that's how most of the cases you enter the case with hysteria, and it would be beautiful case, and you can cure the case. So actually, hysteria, these are all my tricks of entering the case and understanding the rubrics in a very different form. This is a metaphor rubric. Don't always wait till the patient goes in depression, the patient goes out of control mentally, then hysterical, and then take the rubric hysteria. You will hardly get case of hysteria. Go from the body to mind. That's why interpretation of rubric is the key for prescription. Remember that. I had a beautiful case when the patient became so angry, and so angry she started just speaking anything to anybody, just out of control, anything. I just took one rubric, hysteria from anger, and gave a simple remedy, Rustox. Rustox 1 ml single dose, cured the case. This is the application of rubrics. That's why I always tell to you. First, I was teaching you mathematics, now I'm trying to teach you repertory, how to interpret rubrics. Don't always get the verbatim of rubric. I hope you are understanding, everybody. आप समझ रहे हैं, कोशिश करके समझिए इस चीज को। डॉक्टर रिजवान, आई होप आप समझ रहे हैं, ताकि आप अप्लाई कर सके रूब्रिक। नहीं तो क्या हो जाएगा, व्हाट विल हैपन, आप एक ही रूब्रिक अप्लाई करते रहेंगे हर चीज में, फिक्स्ड हो जाएंगे। You will get fixed with rubric application. You will never be able to understand the other rubrics. Okay. Thank you, Dr. Alexandra, and I hope you get some good results with that cases also. Dr. Vishnu Patil, I think, is my patient. Sumkuwar, Rizwan, आप समझ रहे हैं, मैं कोशिश कर रहा हूँ कि हिंदी इंग्लिश दोनों बोलूँ। और बहुत बार आप देखे होंगे कि आपने ये रूब्रिक इतने कम बार लिया है कवर, फिर भी देखिए, इफ यू सी हिस्टेरिया, नो, इफ आई एम नॉट रॉन्ग, इन हिस्टेरिया there are about 250 rubric medicines, I think, and we have hysterical remedies also and normal remedies also. We have gelsemium also in hysteria. We have we have, I think, calcarea carbon also in hysteria. We have nitramur also in hysteria, and we have moscus also in hysteria. We have valerian also in hysteria. We have coculus also in hysteria. The stramonium also in hysteria. Belladonna also in hysteria. So both types of remedies are there. That's how you have to differentiate and understand rubrics. That I told you case of Rustox. We can never think of Rustox. But if your interpretation is right, then it is important. I had a very beautiful case, the patient was frightened by seeing an accident. He was so much frightened, he had seen the whole intestine coming out from the accident. And when he went home, he just went out of control. He just maintained silence and then started shouting and behaving like hysterical condition, playing music, listening to fast music and all. And I just took the one rubric, hysteria from fright, added one symptom, tarantula was given, that cured the case. So tarantula hispana, hysteria after fright, that cured the case. Welcome, Dr. Sai Kiran. So ये सब हमको समझना है डॉक्टर साहब, ताकि we can apply a rubric in very different cases in our practice, either psychosomatic or somatopsychic. आई होप ये समझ गए आप, और आगे चल के हम और कोशिश करेंगे इसको इलेबोरेट करने के लिए. रेमेडीज फॉर एलर्जिक राइनाइटिस व्हेन एल्यूम सिपा आर्सेनिक डिड नॉट वर्क, aggravation evening, aggravation cold weather. I think everybody should help me in this case. Whenever there is what you call rhinitis, sneezing, coryza, which remedy comes to your mind? Anybody? You must give me the answer. Aggravation evening, aggravation cold weather. Anybody? You have to give me some answers, because we have done this in our previous YouTube and Insta live. Anybody? अच्छा, पेशेंट ने बोला कि हमको कि जब भी सर्दी होती है, मैं तो ठंडी में जाता हूँ, व्हेन आई गो इन कोल्ड आई गेट कोराइजा. ऑफ कोर्स आर्सेनिक इज देयर, डेफिनेटली देयर. Any other remedies that comes to your mind? Anybody? Anybody? Any remedy that comes to you? Anybody should answer this question because it is a very open question and we all learn, you know. Simple question. Pulsatilla, okay. Anything else? So I'll just answer the calcarea cup. Okay. I'll just give some remedies. One of the infrequently used remedy which I have prescribed is Anatharium. Anatherum muraticum. First. Second, arsenic is definitely there. Third, think about sanguinaria. Fourth, think about sabadilla. These four remedies are very, very important when the patient comes and tells you in cold air there is. अब आपने बोला है, you have told you sneezing and coryza. With that, you must add two remedies, very, very important. One is Justitia adatoda, very, very important. And other you should add is Natramur and Sabadilla. So this will give you, in majority of cases, good results. Sulfur is there, but if we are specifically telling about cold weather in cold, sulfur would be there. But specific remedy which have got good results are those remedies. Aconite is also there, definitely. Male patient, recurrent tonsillitis, belladonna 80% better. Prostration is too much, okay. Laziness, cold weather, desires, feel hot and feel cold alternately 3 or 4 times, cough is in, okay. So you have given belladonna, patient is 80% better. Now you have added physical prostration too much. If there is physical prostration too much, that means you must think about arsenic album, muriatic acid, gelsemium, and then calcarea ars. In your case, calcarea ars fits the case because acid is there, weakness is there, belladonna has worked, so chronic of belladonna is calcarea carb. But in your case, arsenic, the weakness is very important, so calcarea ars will cover the case, Dr. Madan. Calcarea ars, I think you should prescribe to that case. I have told you before malignant weakness, muriatic acid, arsenic, malignant weakness, so much so the patient slides down in the bed. So in your case, Dr. Madan, do think about calcarea ars, arsenic, gelsemium and muriatic acid. Yeah, I have used Sanguinum nitricum in my practice. I have used. You know, my practice basically, I can differentiate my practice. When I started my practice, my materia medica was really good. It's not because I am telling, it was really good and I could understand remedies and symptoms. Every symptom I could get a remedy. My MM was very good. But as I have matured in my practice, gradually I have started using organon too much, and then different concepts which I have understood in my practice, and then gradually my materia medica is now going down and the concepts are now coming up, you know. So both phases, and Sanguinum nitricum I have used lots in my practice. My mom, out of 100 hairs on her head, has lost 80%. They become tense or nervous over small things and develop watery rash over the head. या रिजवान भाई, आप एक बात ध्यान रखें, अगर टेंशन में बाल झड़ रहे तो बहुत कॉमन है, नर्वस है. आप इसके अंदर ले सकते हैं रूब्रिक. यू कैन टेक दिस रूब्रिक, हाइपर सेंसिटिविटी, वेरी मच सेंटिमेंटल, और फिर आप ऐड कर सकते हैं, आप ये एंटर कर सकते हैं केस के अंदर. और मदर लोग का रहता है ये थोड़ा बहुत ये, तो आप 2-3 ड्रग दवाई याद रखिए. एक नाइट्रम्यूर है, एक सीपिया है, एक सल्फर है, एक फॉस्फोरस है, और एक बहुत रेयर दवाई जो मैंने बहुत यूज़ किया मेरी प्रैक्टिस में, वो है इंडिगो. नाइट्रम्यूर भी है, कैलकेरिया का भी है. डॉक्टर उपल, थैंक यू. मेल 40 years, डायरिया 3 months, नक्सवामी का एंटीबायोटिक, आर्सेनिक फूड, चपारो, no relief, comment any remedy, patient anger on trifles, heat with anger. See, whenever there is a patient where there is a lot of anger and lot of diarrhea and chaparo was given, I hope mother tincture was given, so you must think about one remedy that should come to your mind most of the time is antim crude. First. Second, you must think about phosphorus, and third, think about croton tig. There was a very interesting case of croton tig. You know, just last week I cured a case of cough, and the patient tells that whenever I lie down and my head touches the pillow, the cough starts. Normally, we never think about croton tig. There are other remedies also, But when I failed with one, croton tea I gave, and it cured up the case. That's why I remember croton tea very well. So it's already 3:30 and we are already half an hour plus. I hope you enjoyed, everybody, the YouTube and Insta live. Every time I have new doctors and new questions. I hope I'm able to satisfy your questions and help you that your practice grows. Thank you so much. Thank you, and meet you next time on next Saturday with another session of YouTube and Instagram live. Thank you so much.